Hello everyone, welcome to Radiation Wisdom Hub. I am Sudarshan, Senior Radiation Therapist, and I am going to show some informative video on the testicular radiotherapy challenging irradiation site. So I am delighted to welcome you all to today's case report that both clinically ingrained and critically relevant that primary testicular lymphoma, it's PTL. So this session aims to provide a comprehensive understanding of PTL, including the clinical presentation, diagnostic approach, and current management strategies. So as we explore in this subject, it's important to recognize PTL represent a unique subset of non-Hodgkin's lymphoma, primarily affecting elderly males. This field, it's a rarity of PTS, demand attention due to its particular clinical features and challenges it poses diagnosis and their management. So in PTL, patient often present with a painless swelling on the testicles, which can be easily overlooked or mistaken for the other benign condition. This underscores the importance of throughout a clinical evaluation and the high index suspicious testicular malignancies such cases. Today, we embark on an exploration of a rare and clinically significant entity, primary testicular lymphoma, that according to only 1 to 2% of all non-Hodgkin's lymphoma cases, approximately 9% of testicular malignancies, the PTL represent a unique challenge in their diagnosis and their management.
So let's begin with the topic testicular radiotherapy, a challenging irradiation site. So, first of all, the section overview. So, introduction, objective, case history, radiotherapy simulation technique, planning CT scan, radiotherapy dose, treatment planning, conventional treatment approach, drawback of conventional treatment approach, and last, the conclusion. So, we will go through these steps. So first of all, here is the introduction. So testicular radiotherapy is require a certain neoplasm, like a primary testicular lymphoma, but is a challenging due to testicles location in scrotum, posing immobilization difficulty and a lack of standardized treatment workflow. So careful radiation planning is needed to give appropriate dose while minimizing exposure to healthy tissues. The challenge is achieve a comfortable, reproducible, and effective treatment position while protecting the penis and the covering the superficial layer of scrotum. So here is objectives. So the to justify a role of immobilization in testicular radiation therapy implies a need to provide reason and evidence supporting a use of technique or device that restrict movement or position of testis during the treatment. So here is a case history. So a 56-year-old male patient presented with a painless swelling in left scrotum, persisting last 2 months. The patient underwent left osteotomy. The post-operative histopathology reports indicates primary testicular lymphoma. So it's PTL. Staging PET CT scan shows this large para-aortic nodal mass. So he given 6 cycle of chemoimmunotherapy and the post-chemotherapy PET. So PET CT scan shows a complete metabolic response. So as the testicles statutory seat for the chemotherapy due to blood testicle barriers. The chemotherapy agent do not reach the testis, hence the risk of relapse in the opposite testis. So just a small overview of a blood testis barriers means what is blood testis barriers. So the blood testis barriers is like a protective wall that keeps harmful substance out of the testis where sperm is produced. So this barrier is important because the testis need a safe environment to make a healthy sperm. So imagine our body is like a castle and the testis like a special room inside the castle where precise things are made. The blood testis barriers like a strong wall around this room that keeping evidence. So for example, when someone undergoes chemotherapy, which is a powerful treatment for the cancer, it can harm healthy cells along with the cancer cells. But because of barriers, the chemotherapy drugs have harder time to getting into the testes, protecting them from the damage. So the blood testis barriers acts like a statutory shieldings the testis from harm during the treatment like a chemotherapy. So to avoid the scrotal radiotherapy is a part of standard treatment protocol for the PTL. Various studies have recommended various dose fractionation schedule, but the most accepted schedule is a 30 gray in 15 fraction. So it does survey relevated that most institute utilize a conventional electron beam therapy without CT-based treatment planning for the PTL. While this approach typically provides adequate dose coverage of the planning target volume PTV, so it's important to consider a potential risk of underdose at the dorsal aspect of the PTV as well as the risk of hotspot near irregular patient surface. So here is a main radiotherapy simulation technique process. So here we can see the detailed explanation of the radiotherapy simulation technique for scrototesticular radiation. So patient positioning. So the patient is positioned in the supine position on the treatment table. This position allows a optimal access to the scrotum and the testicular region during the simulation. So immobilization mask preparation, so we can make that immobilization as you see in the picture. So an immobilization mask such as a pelvis immobilization mask is prepared and molded to the patient body in the supine position. The mask ensure that the patient remains stable and the consistent position throughout the simulation and the treatment process. So here is a creation of hole. So we can see here is a hole the in penile region. So a hole carefully made in the immobilization mask specifically around the penile region. This hole allows a scrotum along with the contralateral testis to be pulled out through the mask during the simulation treatment. uh, Positioning of a scrotum. So here positioning of scrotum is also important. So the scrotum is genuinely pulled out through the hole in the mask position to rest on the surface of the mask. Ensure that the scrotum adequately exposed to the radiation field during the simulation and the entire treatment process. So for the rest for the scrotum, so we made flap as you see in this picture. So this is flap and this is scrotum rest on the this flap. So we provide additional support to the posterior aspect of the scrotum, a flap created from the old piece of orphic material. This flap positioned beneath the scrotum, ensuring that the remain stable and well supported during the simulation and the treatment. So the positioning of penis is also important for the exposure. So the penis is carefully moved outside of the irradiation field to prevent exposure to the radiation. It is fixed to the mold using the tape, ensure that the remains surely positioned throughout the simulation and the treatment process. So here is application bolus. So we made application bolus for superior and anterior aspect as you see in picture. Here is a posterior and here is anterior, you can see. So 5 mm wax bolus is placed over the flap created for the posterior support. These bolus help prevent underdosing of the scrotum and the testis by ensuring the adequate tissue buildup in the radiation field. So additionally, a cap-shaped 5 mm bolus is created and placed over the scrotum for the adequate dose buildup on anterior aspect. This bolus is secured in place using the micro tape, ensuring that the remain is in position during the simulation and entire treatment process. You can see here. So both the anterior and posterior, you can see here this cap shape wax bolus. So by following the all entire the treatment and simulation process for the scrototesticular radiation, is effectively simulated for the radiation therapy, ensuring that the adequate and the precise delivery of radiation while minimizing the exposure to surrounding healthy tissues throughout the entire treatment. So after that, planning CT scan. So a planning CT scan performed from the GPS sternum to mid thigh. The CT scan uses a slice thickness of 3 mm, the patient hand position over the head during CT scan. The resulting images shows both the immobilization mask and volus as illustrated in the accompanying images. So here is a radiotherapy dose. So fractionated consultative radiotherapy was scheduled for the entire scrotum, encompassing the post-operative tumor site and the contralateral testes. This treatment approach following the guidelines set forth by the International Extranodal Lymphoma Study Group (IELSG) and the International Lymphoma Radiation Oncology Group (ILROG). The total prescribed dose was the 30 gray administered over the 15 fraction at the rate of 2 gray per fraction, 5 fraction per week. So this fractionation regimen ensures that the effective dose delivery of radiation therapy while minimizing potential side effect and optimizing treatment outcome for the patient. So here is a treatment planning. So after that procedure, so main important thing is treatment planning. Without treatment planning, we can't treat the patient with a appropriate dose. So in this case, the entire scrotum was delineated as the clinical target volume. It's CTV. With an additional 1 centimeter margin is added, a compass potential microscopic disease spread and uncertainties resulting that the creation of planning target volume PTV. So the treatment planning process involved that utilize the 4 MV photon beams and a three-dimensional conformal radiation therapy 3DCRT technique. Specifically, anterior obliques beam were employed. The effective various planning strategies was compared, and it observed that the coverage of planning target volume was significantly improved when employing appropriate dose wedges and oblique angles. So, based on the comparative study of the dose value histograms depicted in the figure, it was evident that PTB coverage was superior when using oblique angles and wedges. As a result, the decision was made to treat a patient using the 3D technique. So you can see here the total coverage on this picture, first picture and second picture. This approach highlights the critical significance of choosing optimal treatment planning techniques to achieve a specific dosimetric goal, particularly ensuring that the 95% of prescribed dose received by the 98.9% of the target volume in the patient underdosing scrototesticular irradiation for the primary testicular lymphoma. So here is a DVH statistic report we can see here. So out of 30 gray, so patient received 28.7, almost 98% of dose received by the target. So you can see here the 95% of dose received by the 98% of uh, PTV. So previously patient treated with the conventional treatment in frog leg position. So the treatment technique employed clinical non-coplanar beams for scrototesticular irradiation. So we found few drawbacks in the treatment approach. So no immobilization. So it means lack of reproducibility. So need daily field adjustment by the technologists to encompass the scrotum within the field. So dose heterogeneity due to the dose area and high dose area at various places within the PTV. So possibility of skin reaction in groin folds due to the dose buildup. So here is a total conclusion over this case study. So immobilization plays a critical role in ensuring that the success of radiotherapy for the primary testicular lymphoma by providing a stable position and accurate targeting and minimizing the reaction of the treatment area. So lack of consistency on the simulation or planning technique for the scrototesticular irradiation in PTL underscore the need for the further research and the collaboration in this field. So dispute the challenges posed by the BTL reality, ongoing efforts to innovative and expand our understanding of optimal treatment strategies are essential to improving outcome for the patient. With the malignancy. So this current approach, utilizing the thermoplastic immobilization mask and oblique beams with the anterior portals, offers a more refined and triggered approach, potentially leading to improved treatment outcome, reduce the risk of side effect for the patient with primary testicular lymphoma. So we can see here for the some references which we have taken for this study.
Hope you all get the informative video throughout this lecture on the topic of testicular lymphoma, a challenging irradiation site. So if you have any doubt or if you have any question, please reach out or comment below. If you like the video, please like, share and subscribe. Thank you.